January 2022, over 30 workers in Serenge, central Zambia, were diagnosed with manganesm, a devastating health condition resulting from prolonged exposure to manganese. This disease has impacted former employees of Indian-owned Southern Africa Ferroalloys Limited company working in Serenge. To gain a better understanding of what this means for the patients and their families, we are joined by Dr. Dickson Munkombwe, neurologist at Levi Mwanawasa University Teaching Hospital here in Lusaka. Dr. Munkombwe, it's a pleasure to have you here.
Okay, thank you very much for having me and for the invitation to speak to you. So, manganesm is the condition that results from the toxic accumulation of the mineral manganese in the brain and related structures within the brain. Yeah. So, manganesm comes about via many ways, but eventually it's in whichever ways we expose you to high amounts of manganese metal, which will then deposit in the brain. So among the ways is inhalation of the fumes of the metal, and then you also have exposure through contaminated water. At times it can be in those who cannot feed orally through feeds which have got high manganesm.
So, Doc, what are the symptoms of manganesm?
If we say manganesm, then we restrict to the central nervous system, that's the brain. But when you have manganese exposure, it can affect other systems as well. So commonly through the inhalation route, you can have the lungs affected. If it's through the gastrointestinal tract and you have some dysfunction in your liver, you can have symptoms of liver failure or liver being affected. But in the brain, which we are talking about since I'm a brain doctor, manganesm mainly presents with symptoms, neuropsychiatric symptoms, symptoms of some psychiatric manifestations as well as neurological manifestations. Yeah, so the psychiatric manifestations can include things like mood changes, anxiety, depression. In some severe forms, somebody can be hallucinating things which are not there, or they can just be psychotic altogether, psychotic.
How do these symptoms progress over time?
So naturally, if the exposure is not removed, so what will happen is that the psychiatric symptoms will continue, then these neurological symptoms will start to come in. So somebody can have symptoms of what we call overt Parkinsonism. So they'll be slow in doing things, their faces will be mask-like. And then if the exposure continues, you find that their cognitive function also gets impaired. They will be unable to perform tasks, a few complex tasks. Eventually, they might even be unable to take care of themselves. Eventually, if the toxicity is not removed, it progresses. Somebody can start having falls because of the movement axis being affected so much. Eventually, they can even die from the complications of the disease.
In what ways do the symptoms of manganesm differ from those of Parkinson's disease?
If it comes to the neurological symptoms, typically they present with Parkinsonism features, except the difference is that here you'll see also more what we call hyperactive tremors. In Parkinson's, it's more of a tremor at rest, but here you find an action tremor where they're trying to do something, they have a tremor. And then one of the things that should alert you to thinking otherwise besides Parkinson's is usually somebody who is a bit younger, like it's atypical for them to have the Parkinson's disease. And then the exposure to manganesm also raises the flag.
Is there a cure for this disease?
So unfortunately, there is no cure. It's a yes or no question. So it can be cured in the sense that if you identify the source of the manganese toxicity and remove the person away from that, which means the effects will stop accumulating. Yeah, so which means they'll only have the effects of the nerve cells which are already damaged at that point, and those, depending on how adaptable the brain of that person is, they might find other people might even get back to the normal baseline. Yeah, but again, it depends. If at the time you are identifying the exposure and removing somebody from the exposure, much of the brain cells have already been damaged. Those symptoms may not change that much, but you at least halt the progression.
And when you hold the progression, can individuals fully recover from the disease?
So yeah, it also depends on how long the exposure has been. So if it's an acute exposure, maybe in the last few months, somebody has been exposed to high doses and they start presenting their symptoms. And depending on how much of the brain has been, because the binding of the manganese to the brain cells is actually irreversible. Yeah, if it's toxic, it's irreversible, the brain cell will eventually die. So depending on at the point at which they started with, they can actually go back to normal if it wasn't severe at the onset. But in most cases where they present late, you find that even if you remove them from that toxicity, the manganese is already in the brain and still binding more cells. You can actually find that for some, the symptoms that even still continue progressing further because the amount of toxin which was already in the blood was already high in the brain cells.
What advice would you give to the families that are taking care of these patients?
If the symptoms are those which are not getting reversed, it's important to counsel them and then for them to understand that this is now a chronic condition and their loved ones or the patient's baseline will not change that much from the way it is. So it has to be about adaptation to the current needs the patient has at that point, which in cases of severe disability can be quite hard, seeing somebody who is okay and then this time they're unable to move or do most things. So it's about understanding that it's a chronic condition which will need adjustment in life, big adjustments, especially where the patient becomes dependent on everybody else.
Thank you very much, Doc.
Thank you very much.
That was Dr. Dickson Munkombwe, neurologist, Levi Mwanawasa University Teaching Hospital here in Lusaka. I've been your host, Charles Maffa. Goodbye and God bless.